This is the wellness segment of the show, Fresh, and we are here in the dental offices of Dr. Norm Bryan and Dr. Anjana Gupta. And Dr. Bryan, always good seeing you, and we'll be chatting a little bit with you, but I wanted to say hi to Dr. Gupta here and tell you how much that session last time meant to me, because I've had that experience of being a first-time patient of yours, and that's kind of what you covered last time, and you really lowered that fear level, I think, for a lot of viewers.
Well, I hope so. For anybody that caught that segment, I hope that maybe answered some questions or helped people with any of their anxieties or curiosities about what happens when you come to the dentist for the first time. And so hopefully that'll help people if they are thinking about making that step. And we know that we all need to be seeing a dentist regularly, that'll help them kind of go for it.
Absolutely. Well, thank you, Dr. Gupta.
Thank you, Craig.
Dr. Bryan, always good visiting with you. And, you know, what I really appreciate about your work is the fact that you take it way beyond dental care. And what happens in your mouth has so much to do with overall wellness. And that's why I think this segment fits so well in the show. It is important.
Well, indeed it is. And I agree. I think it fits well in your show as well. We do want to stress to people that their oral cavity, like I said before, is kind of the overall way that we see how their wellness is of the rest of their body. And of course that's our vision into their wellness, and it's so important. The teeth are very important, the oral structures are very important, and we've dealt with sleep apnea. We've talked about that. We've talked about the TMJ joint, the headaches, the neck and shoulder pain that may elicit. And I just wanted to stress to people the importance of maintaining that oral cavity and seeing their dentist regularly.
I think Dr. Gupta, even last time, talked about the fact that, you know, in this economic downturn, it's important to keep in touch with your dentist. And even if you have to come in with a goal of maybe just for the next visit, scaling it back a little bit, but just getting here and getting that checkup, I mean, even just doing that is critical.
We all have priorities, and in these economic times, I mean, we all have to feed our kids and obviously pay our mortgage. But sometimes we can forget about some of the other important things that really do need attention. And I think that a lot of people, I like to analogize their car. If they're not putting oil in their car routinely, if they're not waxing that car routinely, eventually it's going to show its its wear and its age, and it's going to fail. And the same thing happens in dentistry. The earlier we catch something, obviously the less expensive it is. If we can maintain this on a routine basis, hopefully we'll never find a problem that's going to need that kind of care. But I do want to emphasize the fact that you are not invincible. A lot of times when we're children, our parents take care of these issues and make sure we see the dentist regularly. And through school and after school, and as we're in our 20s and 30s, we get this air of invincibility. And unfortunately, we may pay our dues for that. So I would just really want to stress people's self-responsibility, if you will, that this is something that is important. I can't stress enough how even one tooth can be a terrible loss, like the dominoes, if we don't take care of it.
Now, Dr. Gupta and Dr. Bryan talk a lot about that first-time visit, and when we're here in your office, Dr. Bryan, we really like to talk about the fact that it is a pleasant experience, and you don't want to put guilt on anyone at all, but if it's been a while for someone watching right now, the good news is there's no guilt, and it's really never too late to come visit, is it?
Absolutely not. It's never too late, even if you've experienced problems in the past. I think that it's important that you make sure that you can rectify those problems, or hopefully, like I say, keep them from happening in the first place. Yes. But if we do have problems, we deal with a lot of complex dental issues. But again, the simple situations, the fillings, the cleanings, the overall examinations, the cancer examinations, all these are really important. And I do want to stress to people that they shouldn't neglect this area of their mouth. It's so important for the rest of their body.
And how often, doctor, are you recommending now that folks come and make a visit to you, or really, for that matter, any dentist?
Well, you know, those people that have really good home care and can take care of their tissues, they don't have bleeding gums, for example, no discomfort, that sort of thing, we feel a 6-month recall system is perfect. Now, there are a lot of folks that may have issues that may need to come more often, but again, it should be evaluated in the first appointment, and we can kind of determine from there how well they're maintaining their mouth themselves.
All right, some good information here from the offices of Dr. Bryan and Dr. Gupta. And Norm, what's the best way for people to connect with you personally if they would maybe like to follow up on some of the information they've heard here today? A phone call or a website?
Well, we can always, the website has got a lot of great information for us. I think they can learn a lot about our office, about the things that we do here. Obviously, a phone call, would be glad to talk to anyone or set up an appointment to see anyone for either an emergency situation or hopefully for just a new patient examination.
All right. Dr. Bryan, always good seeing you. Thank you for the wonderful information.
Well, you're very welcome. Thanks for coming in this morning.
I appreciate it very much. And we'll be right back in just a moment here on Fresh, so stay tuned.